Welcome to Wonder Hair Career Institute Online. My name is Levina and I'll be your instructor. Today we are going to talk about repositioning or side lying position. Change resident position to a supported side lying position. During your skill, your care plan or what the skill sheet that you're gonna have on that day will read this way. You are asked to change the position of a resident who is lying on his or her back to a side lying position. The resident requires support to remain positioned on the side. The role of the resident is played by a person. This is how your instruction card is gonna read on that day. So we already know about our indirect skills. You should not forget that you have to greet the person by name and introduce yourself. You want to make sure you provide explanation to resident and back care before beginning and during care. Now we know about positioning. What is positioning? Changing somebody's position. What are the importance of repositioning? Changing a patient's position in bed every 2 hours helps keep blood flowing. This helps the skin stay healthy and prevent what? Bed sores. Turning a patient is a good time to check the skin for redness and sores. We still go back to our clinical skill checklist. We'll start from number 3. Number 3 says, assist resident with turning onto side before placing positioning devices. What are the positioning devices you will need on that day? 3 pillows. These are your positioning devices. Keep resident position a safe distance from the edge of the bed at all times. When you want to turn your resident either to his or her left side or right side, you want to make sure that patient is on the center of that bed. You don't want a situation where you have to turn the patient and the patient is at the edge of the bed, because you don't want that person to fall out of that bed. Use positioning device or pillow under or against resident back that maintains side lying position. Position on side with upper knee bent in front of the lower leg, meaning that the leg that is directly on the bed is going to be a little straight. The one on top is the one that is going to be what? Bent. Support resident top leg by placing device padding or pillow between legs. That is one of the pillows. Position device or pillow placed between legs so that the bony prominences of the knees and the ankles are what? Separated. When you are positioning that pillow, you want to make sure you support the knee and the ankle if it's the one on the leg. If it's the one on the arm, you want to make sure you support the wrist, the elbow, and the shoulder. Leave the resident position on side with towel lying on the shoulder, arm, and what? Hand. Remember, the patient has pillow already on the head. When you position that person on the side, the head moves away from where it was originally on the pillow. So you want to make sure you adjust the pillow on the head. Leave pillow place under head position to also support the resident neck and the chin. On your exam day, you want to make sure you reposition the pillow on the head, making sure it's supporting the what? The neck and the chin. Place device, which is pillow, to support the resident upper arm, supporting both the shoulder and the arm. Ask resident about preferences. We'll stop there. So this positioning, you want to make sure the position your pillows, if it's on the leg, is supporting the knees and the ankles. You don't want the leg or to be hanging. The ones you put on the arm, you want to make sure it supports the shoulder. You want to make sure it's supporting the elbow, including the wrist or the hand. Remember, you didn't bring pillow for the what? Head. But that doesn't mean you will not adjust the pillow on the head to support the neck and the chin. This is little tips that you might need during your changing positioning skill. Now, I have a question that I need to ask on this skill. A resident must stay in bed for a long period of time. What will you do to prevent the patient from developing pressure ulcer? The answer is turn and reposition the resident according to schedule. Then, if you have options that say reposition your patient every 2 hours, that is a good answer also. Another question: why should residents who are unable to change their positions have their positions changed by staff at least every 2 hours? Remember what we said earlier, that it helps to promote blood circulation. That was promoting circulation at what? Pressure points. That's why we have to reposition people that cannot reposition themselves at least every 2 hours. When a resident is dark skinned, the first sign of skin breakdown, instead of appearing pale or red, may appear what color? Purple. Now, as a CNA, as a nurse, if you are moving your resident, you are turning them, you don't expect the red color you will see on a white skin to be the same on the dark skin. So you want to make sure that you are checking the resident's skin for all these color changes. And as a CNA, what will you do when you notice any changes on your patient's skin? Report to the nurse. I hope this lecture is helpful. If you like this video, please subscribe and hit the notification button. Good luck in your exams. Thank you.